So coming to oral pathology, when we try to diagnose cases, especially after you complete your pathology, there are certain conditions in the oral and maxillofacial region, especially the odontogenic tumors and cysts.
I know that the buzz is around for our new episodes on getting insights on various branches of dentistry. So that brings us to another episode of Tut Talks, Navigating Your Dental Journey. I know NEET MDS can be quite a maze for students like you and me, where there's so much confusion and so much dilemma about which branch to choose and how to choose it and whether it is the best branch for you or not. Let me quickly introduce myself. I am Dr. Ichita Joshi and I am your host for these episodes. And before diving deep into this, I would like to take a moment to thank Cuspyd, whose support makes this show possible. So Cuspyd is an evolving edutech company who are putting lots of efforts to put out some fun and interactive content for students like you and me, and they are putting in efforts to transform the way in which dental professionals learn and grow. So today we have the privilege of having our special guest, Dr. Kranti Kiran Reddy, sir. Sir is currently working as the Director for Research and International Affairs, and he's the Professor and Head of Department of Oral Pathology at Malla Reddy Health City. Sir has done his BDS from the Tamil Nadu Dr. MGR Medical University and his MDS in Oral Pathology and PhD from Savita University. With a clinical and academic experience of more than 13 years, Sir has his name under various national and international publications, also including some patents and books. So, Sir will help us here in understanding more about the branch of oral pathology, and he is here to share his wisdom with us. So, thank you so much for coming here, Sir.
Thank you so much, Ishita, for inviting me and making part of your initiative of emphasizing more on dental education.
Yes, so we're really looking forward to getting more knowledge from you. So let's sit back and get ready for the exciting conversation with Dr. Kranti Kiran Reddy. So that brings me to the first question. What is the scope of oral pathology and what this branch is all about?
So coming to oral pathology as a subject, your oral pathology beginning starts basically from your first year itself, where you are taught with basics of oral histology. Once you have your histology basics in position, then you will be able to understand pathology, which comes in your third year. So until and unless your basics are right in your first year, you wouldn't be able to understand the pathological concepts. So basically pathology or oral pathology deals with the pathologies associated with the oral and maxillofacial region.
Okay, sir. So I'm sure this branch, it is really vast, because I remember as a BD student, our oral pathology books used to scare us a lot because it had so much information and so many clinical cases. So, sir, if someone chooses oral pathology as a branch for MDS, so what all things they should look for while choosing a college or in that department? So, any important points that they should keep in mind?
Yeah, that's a very good question. So when you look for a subject of oral pathology as your master subject, so you should be very shrewd and astute in trying to select the right institution.
Yes.
Because the right institution gives you a lot of clinical material as well as the cases to diagnose with. Oral pathology basically, deals with diagnosis, pathology, and the intervention of various oral and maxillofacial pathology lesions. So in order to be in a right institution at the right time, they need to check whether the college is having a good number of clinical material or not. Yes. So I was fortunate enough to be in one of the topmost institution in the country, which is Savita Dental College, which is the only private institution boasting of more than 1,000 to 1,500 patients per day. Okay. So such is the thing. And then oral pathology, basically you need to have a lot of clinico-pathological interactions to brush your skills. So basically it is the clinical material and it is the institution which matters.
Okay, sir. So suppose someone chooses oral pathology, what would they be studying in first, second and third year of this MDS curriculum?
Yeah, so the curriculum basically is decided by the respective university, and Dental Council of India also gives you the specific curriculum which has to be taken in each and every year. So basically the first year oral pathology deals with oral histology, which you have already learnt in your BDS first year. So it is just refreshing and recollection of already learnt facts. Yes. And then you also have the basics of anatomy, physiology, biochemistry, microbiology. Apart from these, you also deal with research methodology, like basics of research methodology, biostatistics. These are the subjects. And when you go to the second year, it depends upon each university. For example, in Tamil Nadu, Chennai, you also have a second year exam which deals with pathology, oral pathology, and then lab techniques, which are usually part in third year in the other universities. So second year includes that, and then the third year you deal with the grand viva essay question as well as your lab and histotechnics. So in comparison, totally you have exams in first, second, and third years.
That is great to know. I think there is a lot to learn in the branch of oral pathology. But there is one fact that I would like to know, that people say that it overlaps with some medical specialty like general pathology. So, what is that factor that makes you people, the oral pathologists, stand out of the crowd?
Yeah, a very good question. So coming to oral pathology, when we try to diagnose cases, especially after you complete your pathology, there are certain conditions in the oral and maxillofacial region, especially the odontogenic tumors and cysts, which are specifically diagnosed only by oral pathologists, because general pathologists per se as such, they do not deal with oral and maxillofacial regions. So they deal with the other lesions in the head and neck region, but the dental oral pathologists specifically delineate in that particular fact that they'll be able to diagnose these lesions more in particular specifically. So that is one thing. And then the second thing is, now as per the latest NMC guidelines and all, so dental pathologists are also being, a gazette is being tried to pass out so that we'll be able to diagnose and be a signatory authority in various NABL and NABH accredited hospitals. So if that comes through, then oral pathologists will have a bright future. So we are awaiting the prospects for that.
Sir, it's really nice to know about it. I think there's a lot of scope that we can see in oral pathology, and really looking forward to all that in future. So coming to something that is related to it, and that is the research aspect. And since you are so experienced in this field, in the research field, we would like to know more about the scope of research in oral pathology and what kind of job opportunities you can get.
So coming to the oral pathology as a subject, this is one such unique subject among all the 9 specialities, which specifically deals with research, molecular biology, and various molecular aspects. So oral pathologist comes with a unique experience or expertise of trying to have basic research methodology skills which are essential for doing experimental research or exploratory research for that matter. So dental oral pathologist specializes in all the molecular aspects which are part of the critical part of the life sciences department. So we basically expertise in trying to get the various concepts of molecular and biological aspects, be it proteomics or genomics or various other specialties in life sciences. So that gives us an upper edge in trying to delineate with the other specialties. And coming to the various grants, so I specialize in trying to write grants with various central government agencies like ICMR, DBT, DST, and SERB. So I specifically have got grants with regard to Department of Biotechnology's BIRAC. BIRAC stands for Biotechnology Industry Research Assistance Council, and in that you have various schemes like Biotechnology Ignition Grant, which is a startup initiation grant where you try to get 50 lakhs grant is being provided by the government, wherein you have a unique innovative idea that can be taken to market for commercialization.
Okay.
So one such unique grant is that. So once you are granted with the BIRAC VIG, and then the sky is limit. So you can go for various other grants.
Okay.
So that grants initiates and takes you to the further level of steps. Okay. And apart from not just BIRAC and DBT, you also have grants from the DST, Department of Science and Technology, under which you have various schemes like SEED, NCSTC, International Cooperation Division, wherein I closely work with governments of United States as well as European countries. So there are a lot of schemes which I think until and unless you venture into it or dwell into it, you won't be able to identify them.
Okay. Yes, sir. Even I am, as a student, hearing about all these organizations and all the grants that you can get for research. I mean, I'm sure more people should know about it, and that will definitely help them in venturing out in the research aspect. Another thing that I wanted to ask you is something related to research again. So coming again to the MDS curriculum, we have thesis and library dissertations and some research quota. So what advice would you like to give to students for selecting a thesis topic or doing the research work?
Yeah, this is a very good question. That's what I do in my institution as well. So whenever this thesis topic is selected for the dissertation, I urge the student, it's just not being confined to a part of a dissertation. So it should have some kind of impact or a commercial value that goes beyond it. Maybe you're not going to do your PhD with that particular topic, but at least it should be given in such a level that it should be taken to the next, from lab to market, what we say. So that should have some kind of a commercial value for the student who try to select that particular topic. So that will be useful for their next future academic prospect as well. And then we also try to tell the students not just doing a basic academic or exploratory research but also try to have a topic which has a more of commercial value, commercial angle to it. Yes. So that's how a topic is. That's why we collaborate with various central government agencies, especially being in Hyderabad, which is an ecosystem for biotech companies and life sciences. So we collaborate with various institutes of national importance like IICT, CCMB, IIIT, the IIT, BITS Pilani. So we have networking with this. Nowadays, all the labs are opened up. The government of India has also come up with the common policy that is shared common facilities. So you don't have to have these costly setups in these institutions. So you can approach these institutions to have the common research shared facilities to explore your research.
Okay, that is great to know, sir. So, sir, as you told us that you have done your PhD from Savita University, and doing a PhD is, one task in itself. So, I really wanted to know that is it necessary to do PhD after oral pathology MDS, or it was your passion that led you for it?
Yeah. So after my experience of 10 years in oral pathology, so once I've become a professor and head in the department, so it's just a monotonous life. Then I started realizing what is more beyond pathology. So once when I ventured into this startup ecosystem, then I realized this is just not the end of the career. So you need to refresh your skills. There's a saying that you update yourself or you are outdated. So we have to, update our skills constantly in order to bring up your future endeavors into reality. So that's when I started my PhD. So PhD is basically my research topic, which I'm most fond of. So I'm doing currently my PhD in that particular field as well.
Great, sir. One quality that I really appreciate in you with this conversation is your willingness to learn new things. I mean, learning never stops. And no matter how old you become, the curiosity and, the willingness to learn, it always helps you. So I would make note of this and, add this to my life also. So, sir, coming to oral pathology branch and its future aspects or job opportunities in India and abroad. So, what would you comment on that?
Yeah. So coming to the Department of Oral Pathology, I mean, once the student completes, so the first major opportunity would be to go in as a staff or a faculty in a dental institution, which you are being taken as a senior lecturer. So it doesn't just end there. So I urge the students not to just focus into teaching career. So there are a lot of other opportunities. So currently I also head the Department of Clinical Research at our institution. So where we do a lot of human clinical trials as per the regulatory agencies of Central Drug Standard Control Organization or the Drug Control General of India. So we also have an incubation center called Foundation for Research and Innovations, which deals with supporting the startups who are especially working in healthcare ecosystem or who's already devised a medical device or a biomedical device where he has to test his prototype or does need clinical validation. We kind of help them. And then we also involved in interdisciplinary, transdisciplinary clinical research. So there are other opportunities. And apart from this, in order to do your master's in clinical research, you have other diploma courses where you have to complete that and then get into clinical research. Okay. And it doesn't just end over there. You can also pursue your career by doing PhD. You can also go abroad and plan for your master's in public health or bioinformatics, where there are a lot of many scopes.
Okay, sir. As you mentioned about all the scopes, can you tell us more about the difference in scope when it comes to India and abroad? So how can the scope be different when it comes to degree, suppose masters in public health or something like that?
Yeah. So India has seen a sea of transformation. So coming to the previous decade, I mean, over the past 2 decades, I think we have seen a lot of human talent going outside. So much of the talent, because obviously they want to have a better quality of life. So over the last decade, so there has been a sea of transformation in India. So the biomedical sector and then the research sector has gone tremendously increased, so that you don't have to go abroad. So you have a lot of opportunities coming up in India, and then over the next couple of years or next decade, you're going to see another wave of transformation where India will have a lot of attractive human potential or intellectual potential which would be needed in India itself. You don't have to go abroad to have a better quality of life. So trust me, India is going to be a better place.
Okay, so that is amazing to hear that even India is coming up with great scope when it comes to oral pathology branch and of course research aspect. So sir, it was amazing to know so much about the branch of oral pathology. I myself got a great perspective towards it, and especially for the research aspect, that it just opened my eyes personally that we have so many organizations who are supporting you for research and everything. So thanks for sharing about oral pathology, but now we want an inside scoop about your life also. So I have a few fun questions, keeping apart your love for microscopes and research.
Yes.
So here are a few lineup of questions. So are you ready for it, sir?
Yeah, sure.
Okay.
Definitely.
So sir, can you tell me something that you wish you knew 10 years back?
10 years back. So 10 years back, if I would have known about the current things, what I'm doing, I would have been in more better position than currently.
Yes,
Yeah, like doing this clinical research and other things.
Yes, sir. Learning never stops, and I think it's never too late. And sir, can you also tell me about one rumor about dentists which you wish it was true?
Rumor, they say that oral pathology as a branch doesn't fit into thing. I said, why it is not? So you can see a live example over here. We're trying to break the barriers and then take the department to a higher level. Yeah. So as such, don't think that oral pathology as such does not have future. Yes, it does have future, provided you put your ideas into right direction.
So can you highlight any funny incident or memorable incident from your MDS life or PhD life or BDS life as such?
So BDS life, I could recollect that we were a batch during 2000. We were called as a Millennium batch.
Okay,
so
that's a nice name.
Yeah, so we were called called the Millennium or the Millennium Stars. So we used to be one such unique batch during our career that we used to win all the prizes during our culturals and annual day celebrations.
Totally living up to your name.
Yeah. So we were fondly remembered as Millennium Stars.
Okay.
That's I could recall.
That's great, sir. So coming to my next question. In this, it's like a small game. You have to say the first word or first set of words which come to your mind when I speak this following word lineup.
Okay.
So what would you say about a patient who comes in with a Google diagnosis directly?
Google diagnosis. So this is not the right clinic for you.
Okay, so about national conferences.
National conferences, it's just not a mere fun aspect, but there's also beyond fun aspect of it.
Yes, sir, the learning part.
Learning part, the learning outcomes. Usually students come to just have fun interaction. Yeah, that is also a part of it. But in addition to that, you need to also have some learning and outcomes as well.
So one word which comes to your mind when it comes to microscopes.
Passion.
So your views about histology slides.
Histology slides. So I think students used to, mark certain kinds of things to identify the slides. That looks so funny. So instead of saying, we have to identify that particular image, what it is actually depicting. So that's what I say to the students. But rather than pointing, trying to remember the numbers or the broken slide or some kind of sticky colors, what they put on the slides.
Yes, sir. We all do that.
Yeah. It's natural.
Yes, sir. Sir, coming to one other advice that I'm sure Student Tribe would love to ask you is how to get better at histology or identifying the histology slides and, not just marking it and all that.
So that's why it comes with, constant repetitive seeing of the slides, your hand and brain coordination. So your eyes don't see what your mind does not know. This is saying, right? So you have to counter that particular aspect, then constantly keep looking into the slides, identify the slide. If you don't see the slides, you're not going to remember anything.
Okay. Yes, sir. I totally agree to that. So that wraps up another interesting episode. Thank you so much for joining us, and a huge thanks to our special guest who has given so much knowledge and insights about the branch of oral pathology and research aspect.
Yeah, thank you so much, Cuspyd, as well, for having invited me and giving valuable insights on the Department of Oral Pathology to the students who would like to take up this as a future career proposition. Thank you very much.
Sir, we have a little something for you as just a small gesture from our side. Sir,
Yes.
this is a small token of appreciation for you.
Thank you so much.
Thank you so much for being here. We are truly honored to have you here.
Yeah, my pleasure as well.
So, to all the viewers who are watching this, I would like to say go subscribe to Cuspyd's YouTube channel, and have you checked out the latest Instagram posts? If not, this is the first thing that you should do. And also, we want to hear from you all. So, don't forget to drop a comment below about your thoughts on this episode or any other questions or queries that you have in mind, and Team Cuspyd will get back to you. So, thank you so much for joining us, and see you around in future episodes.